My aim for this master class is very simple. By the end of these 8 to 10 lectures, you should be able to walk into the emergency department, diagnose and evaluate any dengue patient. You should be able to decide which patient can go home or which patient requires admission. You should be able to recognize the critical phase early. You should be able to prescribe fluids properly, avoid unnecessary platelet transfusions, and you should be able to manage a patient of severe dengue with confidence. If that's the skill that you want to acquire, then this masterclass is for you. Now, what we are going to cover in this masterclass? Here we are going to see the pathophysiology of dengue. We are going to see what are the 3 phases that we see in a patient of dengue. We are going to see the clinical features, what laboratory tests are advised for the diagnosis and also during management. What are the differential diagnoses of dengue? Because there are different tropical fevers that present with same type of symptoms, so differential diagnosis is very important. And lastly, we are going to see how a patient of dengue is managed. Here we are going to see what are the admission criteria, the discharge criteria, how fluids are prescribed, when platelets are advised, and how a patient of dengue shock syndrome or severe dengue is managed. So all this is covered in this dengue masterclass. Now first we see what is dengue. So dengue is a mosquito-borne viral disease and it is a disease of urbanization. If there is improper and rapid city development, population growth, and improper waste management, all these favors proliferation of dengue. About half of the world's population lives in the areas of risk, and in India also we see large number of cases of dengue, especially during and after monsoon season. So if you are a working practitioner, you are going to see these patients almost every week during monsoon, and if you are a medical student, then dengue is an important examination topic. So if you are a student or if you are a working doctor, then learning dengue is not optional and it is must. Now how we are going to go in this master class? So here we have one friend to help us. So meet Rahul. Rahul is an engineering student living in the hostel, and throughout this master class we are going to follow Rahul, or this master class is going to be the story of Rahul, and by the end of this master class you will know how exactly to manage or treat him. So the story goes like this. During one monsoon evening, he attends a cricket match and after 1 week he develops fever. Now you are a doctor practicing near his college and he comes for your consultation. Now Rahul is in front of you. He is having fever, body ache, headache, retroorbital pain, and the thought comes in your mind, could this be dengue? Now, before we examine Rahul, before we order some tests, or before we prescribe him any treatment, let me ask you one question: how Rahul reached this stage? And this question we are going to answer in our first lecture of Dengue Masterclass, that is lecture 1, how dengue really starts from mosquito bite to infection. So see you in the next video.